Welcome to the Lean Blog Podcast. Visit our website at www.leanblog.org. Now, here's your host, Mark Graban.
Hi, this is Mark Graban, and welcome to episode 381 of the podcast. It is August 17th, 2020. Joining me for the 9th time today is Dr. John Toussaint. If you are a listener of this podcast, you probably know who he is. If not, I'll introduce him a little bit more in a minute. He's got a new book coming out September 1st. You can pre-order it now on Amazon, co-authored with Kim Barnes. It's called Becoming the Change, Leadership Behavior Strategies for Continuous Improvement in Healthcare. So today we'll talk about the book, but we are going to do an upcoming episode with both John and Kim to take a deeper dive into the book. Today I'm going to ask John about healthcare organizations that have been doing really good work during the COVID-19 pandemic. We're going to talk about the need to further adapt to these times regarding conferences. We're going to talk a little bit about their adaptation to a virtual summit. I'm going to ask John, what are some of his favorite sources to go to keep up with all the developments on the pandemic. And we'll also touch briefly on a free webinar that's going to be presented by John and Kim on Wednesday. It's part of the KaiNexus webinar series. I'll be moderating that. If you want to find a link to register for that webinar, if you want to check out the book, a lot of other resources, you can go to leanblog.org/381. We're joined today by Dr. John Toussaint. He's the founder and chairman of the board of Catalysis, a nonprofit organization based out of Wisconsin and other locales. So, John, thanks for joining us. How are you?
Very good. Glad to be here, Mark.
And speaking of Wisconsin, it's summertime. You're up there enjoying some nice weather, I presume.
Yeah, the weather's spectacular. I love Wisconsin in the summer and fall, and so it's 75, dry, sunny today.
Yeah, well, good. Well, so given the pandemic, you're not traveling. I'm not traveling, but you're still talking to a lot of healthcare organizations. So I was wondering if we could explore, what's happening. What are some of the challenges? What are some of the organizations that are coping better with this time of change and uncertainty? So here's a first question. As much as you can generalize, healthcare organizations who have experience with lean, or they've been building a culture of continuous improvement. Do you have any examples of how those organizations have fared better during these times?
Yeah, it's amazing how important the lean thinking has been in organizations that have been at this for a while in terms of their ability to manage this crisis. And we've heard it from many different organizations that the standardized management system that they've been working on over the years has really gotten them through this mess. We've written a couple papers on this, one for Harvard Business Review, in which we highlighted the work that was done at Morningside Mount Sinai Hospital in New York, when it was really at the peak of the crisis. They were able to use their daily huddle system to really bubble up a lot of great ideas from staff members in terms of what do we need to do right now. And there were thousands of ideas that were implemented immediately at the front line to deal with issues that would have taken weeks if it had gone through the typical bureaucratic layers. So and because of that, they were able to keep their staff members much more safe. They had very few infections. Plus, they were able to improve flow through the emergency room. They added 60 beds, ICU beds, in 10 days by some basically, simple reconfigurations that were based on staff ideas. That's one example. I think the work at UMass Memorial with Eric Dixon's team, another great example of really managing through this crisis, using the lean management system as the way to really identify and solve problems every day. I mean, again, thousands and thousands of staff ideas being implemented at UMass Memorial. Kansas City Children's Children's Kansas City, Children's Mercy, they had really taken their whole huddle system and in many ways changed it into a virtual huddle system that actually got more people engaged and involved and bubbled up problems and barriers on safety issues during the COVID crisis. I mean, I could go on and on and on. The point being that it's really important, especially when you have so much chaos, to have a system that allows you to really focus in on what's most important. And I think the organizations that have been at this and really have built that system have fared much better.
And I've talked to a couple of organizations that where their leaders say the same thing, that the heavy lifting and the work they had put in 2019 and previous years really ended up paying off in 2020. A lean management system isn't something that gets installed in a couple of days as the chaos is occurring. Hopefully, it's there as a foundation. So, I mean, what are your thoughts if, an organization, let's say now, we know there are organizations that really don't yet follow that sort of leadership approach. Things have calmed down a little bit for an organization. How would you make the case that, now is as good a time as any? If they didn't do it a couple of years ago, that would have been, it would have been better if they had, but, what's the argument for starting today?
Well, I think, we've been publishing podcasts from these leaders that have been doing this. And what I would do is go back and look at those podcasts, Lucy Xenophone's podcast. We did ones with Cleveland Clinic, and we've done them with Torrance Memorial out in Los Angeles. We did one with Children's Mercy and several others, and the work at Christie Clinic in Illinois. I mean, so I would go back and listen to those podcasts. They're very simple, 15, 20 minutes of these leaders that have really shown that this system is better than any other system. And use that as kind of the material, the fodder to get people, the leaders, engaged and interested in making some changes. Mm-hmm. And the evidence is out there, I think, both in the literature and the podcasts and other things that suggest that this is the right thing to do. So let's get started. I mean, it's like you say, this isn't a light switch and then all of a sudden it's great. I mean, you got to start somewhere. We always suggest you start with the one or two departments and begin to build that standard work for the management system that really supports those staff ideas and supports the staff, and you spread it from there. So it's time to get started, and there's plenty of materials, both on your website and our website to get started with.
Yeah, and I would certainly recommend the podcast. It's called The Lens. So if people want to go search podcast directory for Catalysis Lens, I bet you'll find it. It's definitely worth seeking out. And you mentioned the HBR article. I'll make sure that there's links and everything in the show notes about how to find these resources that you're putting out, you and the team are putting out at Catalysis. But I want to step back and talk about UMass Memorial, because I had an opportunity to interview their CEO, our mutual friend, Dr. Eric Dixon. And I'll give a shout out to a different podcast. I interviewed him for the Habitual Excellence podcast that I'm doing for Value Capture. And John, thank you again for having been a guest on that podcast. But, Eric and I talked about a number of things. He talked about the power of engaging everybody in continuous improvement. They've been doing this for years. He also talked about the thought process around committing to no layoffs and no furloughs during this time. I saw a headline this morning, a list of hospitals that are bringing people back from furloughs, thankfully. But I think it's really interesting. I admire the stance that Eric took. He was able to convince his board that it was better to invest in their people. So I'm curious, what are your thoughts? Or you've probably talked to Eric about the same topic. This idea of investing in training and continuous improvement instead of taking the short-term benefit of furloughs.
Well, I think that what Eric, he's modeling the way, frankly, in my opinion, for the rest of leaders in healthcare. And the way he's doing that is very much Paul O'Neill-like, respect for people. So the ultimate respect for people is you don't furlough them, you don't lay them off. During the tough times, you build the capability of those people to do work even better. And so investing in those people is the right thing to do. I mean, I love what Torrance Memorial leaders did, where they basically took 500 people and put them into a special pool in which they made PPE. It's like, that's awesome. I mean, they made 5,000 face shields, and they made, they created a disinfectant wipes, and then they also were redeployed to check people in terms of temperature and whether or not they had any COVID symptoms. So, and those people were excited to continue to be able to help in this time, right? So if you weren't an ICU nurse, you worked in the GI lab, but that GI lab nurse could actually do something that was helping her colleague in the ICU. That's what it means to do work that gives your life meaning. And I think, that's the fundamental concept here, is that what Eric has done and what the folks at Torrance Memorial and other places have done is, listen, we really respect you. We want you to be part of this team. We're gonna help build some capability during this time. Maybe we don't have the GI lab open, but we still need you to do some very important work. And to me, that's the ultimate living of the principle of respect for people. And I think Eric is a great example of that we all can learn from.
Yeah. And I love how Eric, he framed it as a choice, and he said he had to sell his board on that choice. And I compare that to organizations that put out statements and say things like, we had no choice but to furlough people, or we were forced to lay off people. And I always find that kind of curious, because that seems to sort of, absolve the leaders of responsibility for a decision or a choice that they're making. So it's kind of interesting. It's just to see the different mindset, where I think, going back to Toyota, times of challenge and tribulation and financial need can spur creativity. I mean, that ultimately seems to be the root of the Toyota production system. So hearing what they did in Torrance,
right,
dedicating people to that challenge instead of just backing off and laying them off. That's great to hear.
Necessity is the mother of invention. And if you tie that to principles, and I think that's the problem with a lot of leadership today is we didn't have any choice. Well, if you had some principles behind your choices, like Eric does, and like Torrance Memorial leaders do, and
like Paul O'Neill did,
like Paul O'Neill did, like many other organizations that you and I have encountered trying to learn this methodology, the principles really drive the choices. And then you do have a choice, and it's based on the bedrock of your management philosophy. And unfortunately, there's not a lot of bedrock in some organizations.
And I think how Eric framed the idea of investing in your people versus furloughing them or laying them off and then having to rehire later. I think of the flip side. Friend of a friend, he's an acquaintance. I don't know him well, but he's a specialist at a children's hospital. He was furloughed, and to our mutual friend and to others, that's surprising, because he's a highly skilled, highly trained professional that you think the organization would view him as more of a partner than a cost to be cut. And so as a result, this physician is actively looking for jobs in other organizations, even though he's been brought off furlough. I think that trust and that relationship was damaged to the point where hopefully he can find himself maybe, well, he's a children's hospital specialist, so maybe not at UMass Memorial, but maybe he can end up someplace where there's a lean management philosophy in place, and next time there's hard times, they'll commit to him.
Yeah, well, I think there's a lot more of this thinking throughout the healthcare industry today than there was, a decade ago.
Mm-hmm.
So my guess is he will, and there's some really great children's hospitals that have been, applying these principles now. So I'm optimistic he'll be able to find a place that actually respects him and will treat him differently than where he's been.
Yeah, no, I sure hope so. So one of the things we want to talk about today, talking about necessity being the mother of invention, the world has changed in many ways, including kind of the, related to conferences, right? So I've said for, I think, the 10 years that it's taken place, that the Lean Healthcare Transformation Summit that Catalysis puts on is absolutely one of my favorite events each year. And, it was, the difficult decision to cancel, understandable decision to cancel that this year. So I was wondering if you could share some thoughts about that and what you and Catalysis are doing to sort of, try to do something different here, since the typical conference wasn't able to happen.
One of the things that we've decided is that this, our motto is learn, share, and connect. So in this time where we can't have conferences, how do we learn, share, and connect? And I think that, every week now we have something that's being sent out through our channels, either a podcast, a webinar, a blog, an article. And these are all based on real work that teams from throughout the world are doing that are applying lean thinking to their work. And so we've really kind of pivoted to say, let's do something, every day or every week and highlight the work of many organizations that are applying these principles. And we've gotten a lot of really positive feedback, whether it's the management system work or, sharing data and information across the system, or how do you actually examine a patient in a car so they don't have to sit in a waiting room. I mean, It's some really cool innovations that have happened throughout the Catalysis Healthcare Value Network organizations. And so what we decided to do is just share as much as we can share. And again, we're dependent on the organization's willingness to share. But what we found is that a lot of people are willing and actually want to share what they've learned because they have done some tremendous innovation. And so that's kind of the way that we've decided to deal with this is let's do real-time sharing of great innovative work in healthcare organizations that are applying lean thinking. And so we have, all these podcasts, all these articles, all this stuff coming out every week, and you can go and pick your topic and go see what some pretty amazing work has been done, whether it's, examining patients in cars or adding 60 ICU beds in 10 days. I mean, it's so that's what we decided, Mark, is we want to share as much as we can, as fast as we can through the crisis so that people can learn and take some of those ideas and innovate themselves.
Yeah. Yeah. I mean, in a way, it's more like continuous flow sharing or, small batch learning, sharing and connecting in different ways.
I think that, the whole conference situation, I just don't know what's going to happen with all of that. I mean, when can we gather together again with 600 or 700 people? I mean, is that ever going to happen? I mean, I hope so, but it's really questionable. So in the meantime, I think we on the education side of things have to really innovate ourselves. We have to be constantly trying new things. I mean, today we're doing this rather than just over voice. We're doing it with video. Okay, well, we haven't done that before. So great. let's try that. Let's keep trying things. That's what we're going to have to do.
There is a specific virtual event coming up on October 21st. I'll make sure we get a link to that in the show notes. The Catalysis Virtual Summit 2020. It says invitation only event actually on the website, but is it possible for someone to get an invitation?
I think if someone's interested in it, then they can contact us, and we'll get back to them.
Okay. So John, you raise one of the important questions of the day of, when is it going to be safe for people to gather again? There's so much I think that has evolved in terms of our understanding of COVID-19 over the past months, and it seems like there's new information coming out every day. So I guess my question for you as a physician maybe has two parts. Like, for one, how do you keep up with information and keep informed? And what would you recommend to the general public? We don't have medical training and education. What are the best ways for people to find, let's say, reputable information as opposed to whatever's just floating around?
Well, that's a good question. I can tell you what I do. It's not necessarily going to be what everybody can do, but what I try to do is base my understanding of things on science. And so I'm looking for specific articles that either confirm or don't confirm what the issue of the day is related to this. So there are two journals that I tend to rely on. I rely on the New England Journal, and I rely on Health Affairs. Those are two journals that publish a lot and have published a lot recently on this virus. I think that there certainly are other reputable publications. I mean, I think Becker's Hospital Review does a pretty good job. I think there's certainly others, and I think it just depends on what your level of willingness to dig into this stuff is. Mm-hmm. My willingness is pretty intense, so I'm going to try to use the science. I think the work that was published by the CEO of Kinexus is accurate. Mm-hmm. Oh. And he's done a lot of work on trying to understand this virus in ways that that he was able to predict where things were going to go. The whole mask issue. I mean, from the beginning, he really said we got to wear masks, and that's when the CDC was saying we don't have to. Yeah. So, I think there are different sources, and you have to choose them. But I tend to I'd like to rely on the science the best we can, even though the science isn't great at the moment. But we're going to see more and more good science, I think, come out of this.
Yeah, well, thanks for mentioning Greg's emails, and those are archived. He's still putting those out on the Kinexus website, so I'll link to that in the show notes. So thank you for mentioning what Greg Jacobson is doing. And one other thing I'll go ahead and mention here for the listeners and the viewers is that John here is going to be part of a panel, or actually part of a webinar that John's going to be presenting with Kim Barnes, who's also from Catalysis, a webinar on August 19th, Becoming the Change, Leadership Behavior Strategies for Continuous Improvement in Healthcare. So you can register for that today. I'll put a link again in the show notes, or you can go to kinexus.com/webinars. So maybe while we're on that thought, John, is all right, maybe we can give a bit of a preview of that webinar. And this is also giving a bit of a preview for your upcoming book. So we're kind of teasing something that's helping tease something else. Can you talk, for one, the importance of becoming the change? Like, for example, you mentioned Eric Dixon as an example of a leader who's leading by example. So why is it important for leaders to become the change?
Well, I think people look to their leaders to determine what's important and really how they should act and behave. And when you model the way, like Eric or Mr. Dubé in South Africa, or many of the other leaders that we highlight in this book, then the culture begins to change. And, culture is all about behaviors. So if you model the behaviors that you want in your organization, the organization will become the change. And that starts with the individual leader. So what we're going to talk about on the 19th is one of the chapters in the book where we actually introduce a way to begin to think about how you might change. And we talk about the personal A3. We talk about how you actually do a self-rating so that you can, our own best and worst critics are ourselves. So if we have a self-reflection mechanism by which we can sit down every week or so and say, what did I do this week that unleashed the creativity of my team? Or what did I do this week that shut everybody down? And if you can self-reflect on those types of questions, it will help you realize, where you want to spend some time in terms of improvement. And so this is really about improving our leadership capability and doing that through how we act and behave. And that's really the whole tenor of the book is, what did these leaders do differently that actually led to major changes in their organizations? And so as they become the change, the organization changes to an improvement culture. Mm-hmm. And that's what we're going to focus on the 19th.
Yeah. So reflection and problem solving and other leadership behaviors will be a big part of what you explore in that webinar. So I'm looking forward to that, and encourage people to go register for that. And then maybe if you can just talk briefly a little bit more about the book. I know we're going to have an opportunity to do a podcast together with you and Kim, hear about the book. So I don't want to totally steal the thunder of that episode, but if you can give just a little bit more of a quick preview, even just in terms of when the book is going to be available, and then we'll dig into it deeper next time.
The book's going to be available September 1st, and we've really divided it into different sections. So there's a section on, okay, what did leaders do that really made a difference in their organizational culture and performance? So what did they do? Then we have a section on, so how do you actually do it, with very specific tools and ideas about how you make these changes happen. And then we have a section on what's the future look like? What's the future of lean thinking? What's the future of innovation in healthcare look like? And so that's how the book is designed. And I think the feedback we've gotten so far is that people are happy that we actually have a how-to part of the book, because most of our books in the past have been, well, we're going to lay this out, here's what people did, and good luck. This book is actually, here's what people did, and here's how you could actually go do it right now. And you'll be able to link to parts of our website to download different types of templates and learning materials so that you can actually do what we talk about in the book.
So I think the last thing we want to explore today, John, is again, I don't see a crystal ball on your bookshelf, but talk about the future of healthcare. How does this COVID pandemic, in your estimation, change the trajectory of what we expect to happen?
I think there's a lot of things that have changed and are going to continue to change. And the first thing I would say is that the financing system has actually changed during this crisis, which is, I think, one of the key drivers for innovation in healthcare delivery. So when CMS determined that you're going to get paid as much for a virtual visit as you were for a face-to-face visit, that really changed things. And then the commercial insurers followed suit very quickly thereafter. CMS also changed some of the ACO payments in terms of the downside and upside risk payments related to the virus, and whether those are maintained or not, we'll see. But I think what it's done is it's made the payers start thinking about population health, which we've been talking about for a decade or more, but we never have gotten to in terms of incentives. And now I think this crisis has really kind of driven us to the payers, and of course the major payer, which is Medicare, to be thinking about the world a lot differently. And so I think we're going to start to see different types of contracts related to this population health work that we've talked a lot about and a few people have done, but it has not taken over the industry, which we need desperately for it to do in terms of the financing mechanism, so that we can really start innovating, get people out of hospitals, start thinking about, health outcomes rather than just sickness care. So that's one thing. Mm-hmm. And I think because of that, I think what we're going to see now is more innovation in healthcare. And I think what we're talking about when we're talking about innovation is care model innovation. So what we want is new care models. We don't want the same old, same old. That's what I loved about what the Christie Clinic did. They examined the patients in the car so they didn't even have to come into the office. I mean, that's cool, yeah. Right? So what other kinds of these crazy things can we do? I mean, Atrius, Health in Boston has done the medically at home piece, and so they're maybe 25% of patients that went into the hospital are being cared for at home now. I mean, these are the kinds of things that we need to develop. The problem in traditional healthcare delivery, though, is we don't have any systems to do that. We don't have new product development system, and so we're going to have to figure out how to do this. We're going to have to figure out how to build new care models. And because we don't have the expertise to do it, and we don't have the wherewithal to do it, really. And so I think that is going to be kind of the next frontier here. Lean product process development work has been going on for a long time in other industries. It hasn't gone on at all, or very little, in our industry in healthcare. So we're going to see that, and I think the financing mechanism is going to start to support that. And it already has through the crisis. And I think I'm pretty excited about all that. I think this is going to be, new frontiers, and traditional old heads in beds in the hospital. Finally, maybe we're going to start to move away from that.
Yeah. And back to the idea of necessity being the mother of invention. I've heard of instances where changes to, let's say, clinic care driven by short-term needs and pressures, or maybe turn into longer-term innovations. So looking at more telemedicine, video visits, that's still a payment. There's some temporary, more about this than I do, of course, but there's payment dynamics, temporary changes that have not yet been made permanent. Is that the case?
Well, I think that the temporary changes, I think CMS has pretty much now said that's what's going to happen. And I was just talking to a former CEO of a large Blue Cross plan And he now works for another large insurance company, and he said that's the way we're going. So I think the payment changes that have changed at this point are probably going to be maintained. And my guess is that we're going to see more focus on actual pay for health outcomes, population health management, disease management, other things that we just traditionally have never gotten paid to do. And that's what I'm hoping, because I do think that then becomes the mother of the necessity is the mother of innovation or invention. I think that we've just had a terribly barrier-filled set of incentives. And as those start to get broken down, I think we're going to need to learn how to do true innovation. And I think that's going to be kind of the next frontier. How do we take our method of lean thinking and add that core element to it, which every organization that practices lean thinking has, except healthcare delivery. And so healthcare delivery is going to have to catch up again with the rest of the universe.
Well, thank you for your efforts to continue pushing in that positive direction. And as you said earlier, learning, sharing, and connecting. So thank you, John, for all that you continue to do and the things that Catalysis does. So again, just off the top of my head, I'll encourage people to go check out the podcast, The Lens from Catalysis. We've got the webinar coming up through KaiNexus on August 19th. And that webinar shares the title of the upcoming book by John and by Kim Barnes, Becoming the Change, Leadership Behavior Strategies for Continuous Improvement in Healthcare. So again, links will be in the show notes. So I hope everybody checks that all out. And John, thank you for being here today, and look forward to being able to do this again sometime soon.
Sounds great, Mark. Thanks. And thanks for everything you do too. It's you're sharing a lot of great information. So we appreciate that.
I'm also trying to learn, share, and connect. So
good.
Thanks, John.
Cheers.
Cheers.
Thanks for listening. This has been the Lean Blog Podcast. For lean news and commentary updated daily, visit www.leanblog.org. If you have any questions or comments about this podcast, email Mark at leanpodcast@gmail.com.